talk a little bit about regenerative medicine of the ankle. The ankle, as you know, is a pretty flexible joint, and it is a primary stabilizer of your lower extremity. If you want to get an idea of how important the ankle is and just how complicated it is, take a look at the robot models that they're doing, like at schools like MIT or University of California, Berkeley, where they're trying to get robots that mimic the motion of a human being. I have yet to see a robot that does not walk with a fused ankle or an ankle that just goes up and down, because when they give it a normal ankle like ours can do, they all fall over. So the ankle is a very complicated joint. It has a lot of input from the brain and the balance fibers in the feet. So as a result, when you hurt your ankle or twist your ankle, it throws off a lot of things. It can throw off your balance as well, because those balance fibers are important. So from a regenerative medicine standpoint, we look at the ankle as kind of like a flexible, it's almost like the concrete base of a flagpole, but like a joystick, more like that. The joystick's got to move smoothly in all directions. You can, with the ankle, inject in the ankle joint itself, because there can be arthritis in the ankle joint and the lining of the ankle can go down or it can be degraded over time. But what's really important about the ankle is you recognize the stabilizing factors that hold it together, and it's predominantly a whole bunch of ligaments that go from the several bones in the ankle up into the shin bone or the tibia, and that little bone to the side of your shin bone called the fibula. So when you inject the ankle, after numbing someone up, don't be surprised if when we do an injection of your ankle, we start injecting areas that are outside your area of pain. Because people will say, well, look, I have pain on the outside of my ankle. I twisted my ankle. So that area where you typically hurt on the top of your outside of your ankle, and some people by the base of their little toe will have some pain because you stretch the tendon there. Well, sure, we want to get those areas, sure, of course. But if you have a little weakness or a little instability on the inside of your ankle, on the top of your ankle, and your Achilles tendon, we want to stabilize that as well. Because down the line, overstrengthening one area and not balancing that out with another area is going to lead to an unbalanced ankle. So the ankle is a complicated joint. The good thing about it is that ankle injections are generally very well tolerated. They don't take that long. You don't need a whole lot of medication, and they tend to work extremely well.